Well, good morning. Last presentation of the day before we go for lunch. I'll try to be not too long. My name is Quentin, Wodon. I work at the World Bank, and this work is done with Amina Demboba and Rebecca Sayer, who are both sitting there. Before I present the slides, maybe I should tell you what our role is at the World Bank that will help us understand what I'm going to present. We are a very small team in a central unit, and our role is to try to help the task managers and other staff at the World Bank who are working on ECD directly with government counterparts. Part of what we are trying to do is to provide them with tools that can help them do their job very well. Okay? All right. So there are four resources that I want you to be aware of today through this presentation and some of the lessons from them. The first is a bit of good news, and I'm going to briefly explain the trend at the World Bank in funding for work on ECD. The second resource is a very short document, about 15 to 20 pages long, that we are finalizing. It should be available in a matter of weeks now, about 25 essential interventions for ECD that we would like to recommend to governments. And we had a few people earlier today mentioning that somehow we are lost in translation, meaning that it's not always easy to translate the research evidence on the benefits from ECD to governments or ministries of finance. The point of this document is precisely that. It is to help ministers of education or health or social protection make the case for more investments in ECD, and for that purpose, it outlines a number of interventions that should be priorities. Now, interventions are one thing, but we need more than interventions. And the third document that I want to share with you, or some of the results, relates to what a few people have mentioned today, and also I think Joan mentioned it yesterday, which is this SABER work program, Systems Approach for Better Education Results. These are tools that help us do a basic diagnostic of ECD policies, funding, outcomes in a country in order to start a policy dialogue with the government. And I'll give a few examples of the kind of results that we get from this type of tool. And finally, I'll conclude. So first, a bit of good news. I mean, ECD is not new on the agenda. I mean, we have been talking about it for a long time. But at the World Bank, a few years ago, when Tamar was actually a vice president, and I think she was very instrumental in that, there was a much stronger recognition of the importance of ECD. And essentially, the education strategy that was adopted in 2010, the health, nutrition, and population strategy, the social protection strategy, all of those strategies adopted a few years ago placed ECD at the core of what we had to do. And so the question is, did that change anything? So to try to answer that question, what we did, and Rebecca led the work for that, is to look systematically over the last dozen years at all of the projects, the grants, the loans that the World Bank did in education, in health, nutrition, population, and in social protection, to try to identify what were those intervention projects and even analytical work that were specifically about ECD. So that was actually quite a bit of a detailed work, because we don't have a system that pops up, these are the investment in ECD. So we had to look at each one of them. Sometimes projects are ECD specific, sometimes a component of a project would be ECD specific. And so this is the good news. We have here the trend in commitments by the World Bank in $1 million. You can see the red line, which corresponds to 2010, 2011, or fiscal year 2011. And after all of those statements on policy, the trend in lending has increased considerably. So that's the good news. Now, we don't know yet whether this will continue at those high levels in the future, but there was a dramatic change. And if you sometimes come to the World Bank and if there is a seminar in ECD, it's very difficult to have a seminar without 30, 40 people in the room. There is a lot of interest in this. Now, this is about lending and grants, and I just want to mention that it's the same for analytical work, advisory services for countries, and so on. Again, we have a large increase in the commitments. The amounts are lower because this is more capacity building, analytical work, and so on. I want to mention that part of what led to that increase in the last few years in analytical advisory work relates to SABER, which I will mention, but part relates also to impact evaluation. We have a strategic impact evaluation fund, which has a specific window for ECD work, and a lot of impact evaluations are ongoing in developing countries, and this helps in trying to reduce the gap that we had in evidence between the more developed and the developing countries. Now, good news said, what we're trying to do is to help task managers who are discussing with governments as to potential operations in ECD. And one of the recent tools that we provided is an identification of 25 key cost-effective interventions. Now, there is no way for me in 15 minutes to go through those interventions. You have the slides. Or they will be made available to you. But the interventions cover nutrition, health, education, social protection. Now, we could argue whether those 25 are the 25. Probably we'll never completely agree. But this is helpful. Why? Because for task managers, it's actually difficult to discuss ECD with a government counterpart. I mean, some of those task managers would be ECD specialists, others would not be. They would be more education specialists or health specialists or social protection specialists. And this helps to identify things that we consider very important so that they can be included in a wide range of operations. Now, that document with this identification of 25 interventions essentially is structured, as I mentioned earlier, to try to get us out of that loss of translation phase. The idea is to provide something that is simple to read, not too long, for ministries that they can use. So for every one of those interventions, what we have is illustrative costs. Actually, data on costs are hard to come by often, but illustrative costs on different types of interventions that may vary between countries, as well as examples of impacts. And here, a lot of the people who talked this morning mentioned a number of these studies. Well, many of these studies are mentioned here, but in a very succinct way, to make the point that investments in young children, they are the right thing to do, but they also bring high returns. So just to mention that also for simplicity, these 25 interventions are then reassembled, if you will, in 5 packages. One which is called family support packages, which has a number of interventions that need to be available to support families for the whole life of the child. Then a pregnancy package, a birth package, a child health and development package, and finally what we call a preschool package. So there is nothing new here. I mean, and most of you know all of this. It's just a packaging of this information to try to make it more easily digestible and hopefully useful, especially for dialogue with policymakers. Now, the other component of the work that we do that I wanted to mention to you is called SABER. This is a resource that is available for you. Everything is on the web as soon as it's cleared. What's the basic idea behind this program, Systems Approach for Better Education Results? The basic idea is that we have a lot of information on the quantity and the quality of inputs or even interventions sometimes. And in the case of education, we might have outcomes such as attainment or achievement learning, but we often don't have much information on the policies and the implementation of the policies that actually transfer inputs into outcomes. This program was started by Elizabeth King for education. ECD in the World Bank is located, in terms of the leadership, within education, so we have a module on education. Most of the other modules of SABER are actually strictly about education. But so the idea is that we try to look at the quality of the policies and the institutions, to some extent, possible, the quality of policy implementation, and finally, the quality and the quantity of education delivered. But SABER is really about policy intent and to some extent policy implementation. And this is just a slide that shows you the different modules of that program. We have ECD, and then we have workforce development, tertiary education. Many of the other ones focus on primary and secondary schooling. Now, how is the SABER-ECD tool organized? Well, it's organized around policy goals and then policy levers. Now, before I explain what these policy goals and policy levers are, let me mention a little bit more background so you really understand what this is for, right? So typically we would get a request from a task manager working on a country. We would like to have the SABER-ECD done. And what we want to develop is a tool that gives you a good basic diagnostic of ECD policies and outcomes in a country, but that is not too expensive to implement so that you can actually collect the information for many different countries, right? And typically it would take 2-3 weeks of a consultant to get the data in the country, and then 2-3 weeks to write the report using other information on the country. Now, so these are indicators at the country level. Some of them come from surveys, like the MIX, the DHS, and so on. Others come from the analysis of legal documents, as well as policies or rules. It's organized around 3 goals: establishing an enabling environment, implementing widely, and then monitoring and assuring quality. Within the 3 goals, you have policy levers. The first one would include an analysis of the legal framework, an analysis of the quality of intersectoral coordination. As you might imagine, and as has been mentioned by many others, you have multiple ministries, multiple agencies working in this field, and a key aspect of the policy framework is that intersectoral coordination. And you have then questions on finance. On implementing widely, there are questions about the scope of programs, what type of programs exist, then their coverage, and then questions about equity, how inequitable is the distribution of access, if you will, to those programs. And on monitoring and assuring quality, there are questions on data availability, quality standards, and then compliance with standards. You can have beautiful standards, but if all the providers don't comply, that's not very useful. And so based on this, what we do is a rating of countries according to 4 levels: latent, emerging, established, advanced. And this rating is provided for each policy lever and each policy goal. Now, this is not with the idea of ranking countries, not at all. This is with the idea of trying to do a somewhat comprehensive diagnostic that is the first point of entry when we want to do policy dialogue with the countries. I have a few slides here that I will pass on very quickly because they are about the website, and the website, we can give you the address, and you have a lot of information there. Now, we have started to implement the tool in 50 countries, approximately. The data is available on the website, I think, for 11 or 12 countries right now. The reason why is because not all of those 50 country reports are finished. About 25 countries we have the full data, but we have to go through a process which is a bit lengthy. First clearance within the World Bank, then clearance by the government before we can put any of this data out. But I would assume that within 6 months or so we would have quite a few additional countries available. Now, what is this useful for? I want to say that it's not necessarily useful for trying to assess the impact of policies on outcomes. That won't work. I mean, this is a very small sample, right? You have a few countries, I mean, up to 50 when we put everything on the web. You're not going to be able to do econometric work that enables you to say, oh, because we have this policy in the country, this is the impact on a number of outcomes. That won't work, most likely. It is also not a tool which is prescriptive. We have some broad policy options at the end of these reports, but frankly, if you want to go into detailed discussion with the country about what should be done, and I think this was the question that Don Bundy asked, and it's not an easy question to answer. What actually do you do, for example, after your 36 months? You need to have quite a bit of a detailed analysis at the country level. But this gives you a tool which is very useful for framing the dialogue with the ministry, or actually several ministries, and then identifying areas where the country could do better in terms of policy or in terms of programs by basically comparing a country versus, let's call it, best practice. Now, to give you an idea of the type of questions that we have here, and I realized I have very little time left. So, for example, on budget. So and finance. We have a question, to what extent does the budget use explicit criteria at the national or subnational level to decide about ECD spending? To what extent are the budget decisions coordinated across ministries? To what extent are governments actually able to report on what they spend on ECD? And these are these three graphs. What you have here is a number of countries among the blue, which are the low income, the red, which are low middle income, and the green, which are the upper middle income countries. You have the number of countries that stack in each of the categories. And a lot of things are towards the left, which means that essentially performance is not very good versus what you would hope. The next question, or the next part of the tool would look at whether financing for early childhood care and education, or ECD in health, is sufficient. And here we have two indicators which are just indicative of what happens, the percentage of the annual education budget allocated towards pre-primary education, and then whether vaccines are funded by the government. The next ones I will go very quickly are about sharing the burden of ECD costs within countries. Finally, the last cluster of indicators related to ECD in the finance part of the tool is about whether the remuneration for ECD workers, pre-primary teachers, other childcare center professionals, and so on, whether these remunerations are attractive enough to have good people in there, or whether the government funds it or doesn't fund it at all, right? So this is a very broad tool that is helpful to try to start this dialogue with ministries and trying to get out of this lost in translation kind of paradigm in which we are. The next phase of this work, we will have to see whether our ratings that were kind of thought through before we collected the data are appropriate, whether there are some more dimensions we should include in the tool, and one of the big part of the work will be towards implementation, and whether when you have policies on the books, are they actually implemented, and then what is the change from the policy intent to policy implementation, and how could you go through a systematic analysis of that change to understand what is happening actually on the ground. So let me conclude. The good news is that at the World Bank, and I'm sure for many other agencies, there is really now much more of a focus on ECD, and the numbers in terms of lending and analytical work confirm that. We also have this evidence on benefits, but we need to translate it better, and these 25 interventions, which are accompanied by a few principles in that document, is our attempt to do that towards ministries of finance and others. But beyond the identification of specific interventions and the benefits of specific interventions, we have to do a lot of work about the systems, and SABER is our attempt to try to get a dent into that program. Thank you.